Hi, so we're going to review growth, development, and nutrition, just kind of a brief overview, which will introduce what we're going to discuss in class this first week on Thursday, which will be each developmental milestone or phase throughout childhood. We're going to cover all of those and then developmental theories as well. So growth and development, of course, differences between the adult and child. The child is in a continuous process of growth and development. Growth spurts are often followed by plateaus. So you've all heard of a growth spurt. With children, depending on the age, a lot of times what will happen is they'll shoot up in height, and then that'll plateau, and they'll put on maybe some weight and fill out more, and then they'll grow and then fill out. So there's a lot of plateaus, but there's a lot of phases throughout, depending on the area of development that they're in. Some develop and grow a lot faster during that phase of time, and some slower. So the growth is measurable, obviously. Not all parts mature at the same time, and not all children mature at the same time. So the impact of growth and development on nursing care, developmental needs, they do have an impact on the child's response to illness. So I think I've briefly touched on this before, but any child that's being hospitalized or that is ill, you need to keep in mind their their developmental stage, and how to appropriately respond to that child to give them the best care, to not scare them, because a lot of times they will be scared. So the nurse, again, you need to know what's normal so that you can recognize any deviations. A child differs in anatomy and physiology, as we know, compared to an adult. So the main thing is their response to their illnesses, and the treatments will be different. So I know you haven't had med-surg yet, but when you do, you'll see similarities where I'm going to go through the different regulatory systems in the bodies for the child, and it is basically med-surg for children. So we'll go through like neurological conditions, gastrointestinal, genital urine or the genital tract, urinary problems, metabolism, endocrine, that kind of thing. But the response to their illness and their hospitalization and the treatments will be different. So the nursing process applied to growth and development. So you guys have taken the clinical judgment course, and you went over the nursing process. So you're going to apply that here to growth and development. So you want to collect data for pediatrics. They're going to get the height and weight, and they're going to plot that on the standard growth chart. So you've probably all seen this, where they'll say, this is the child's height and weight, and according to the graph, the plot for that child's age group, they are at the 80th percentile or 90th percentile, which kind of tells you if they're on track, if they're more, growing at a faster rate, slower rate, or if they're within that normal range. So they also want to record the developmental milestones that are achieved related to the age of the child. Now, every child is going to be different. So just because they're not doing, a toddler's not talking in full sentences, and maybe their cousin or their sibling is, that doesn't mean that they're behind or that they're abnormal. Now, there is, of course, if it exceeds, like they're way behind for where they should be, that's when you need to take note that there could be an issue and report it to the provider. So observe, interview parents if you're concerned, but just observing the child or the infant can give you some cues, some idea of what's going on, if they're acting normally, or if there might be some issues. So analysis, so determine appropriate nursing diagnoses, which we don't really talk about anymore, but related to parenting, coping skills, and any unmet developmental needs. Are they undernourished? Do you see any marks, any bruises, anything like that that you might want to report right away? So offer guidance. Again, I talked about how education is huge when you're caring for families. So you want to offer guidance in teaching to family, school personnel, and the child to meet developmental needs. So it's often called anticipatory guidance when you're teaching parents and about in the pediatric area or just the family as a unit. So that's something you'll hear a lot is anticipatory guidance. Interventions that foster growth and development in the hospital setting can include encouraging age-appropriate self-care. So just encouraging that child to gain some independence, caring for themselves. That helps a lot depending on their developmental stage and milestones in life. Again, here's that anticipatory guidance. You want to make sure that they understand that any changes in behavior, eating habits, and play, what's normal, they might expect within the next year for that child. And then evaluation. So ongoing evaluation of growth and development, follow-up, teaching and guidance prior to clinic or home visits are essential. So some key terms in child development, again, development, we know what that is, growth and maturation. So growth charts, you're going to see this a lot for pediatrics and newborns, obviously. So children who are in good health tend to follow a consistent pattern of growth. At any age, obviously, there's a wide individual difference. There are separate charts for boys and girls as well. So again, you're looking at that pattern of growth. Is this normal for that child throughout their growth and development for each stage? So developmental screenings. The Denver Developmental Screening Test, this assesses for developmental status of children during their first 6 years of life. So they're looking at the personal and social interactive component, fine motor, adaptive, language, and gross motor. So the purpose is to identify children unable to perform age-appropriate tasks, not an intelligence test. So all the following factors are closely related and dependent on one another and their effect on growth and development. So all of these combined are important to note. So hereditary, so it could be, following the child's genetics, that they are maybe going to develop faster, or just some traits that are genetic. Nationality and race, ordinal position within the family. So that means the birth order. So are they the oldest, the youngest, the middle? That has an impact. Gender and, of course, the environment. So it's that whole nature versus nurture. Nature, is it, the genetics, or nurture, is it the environment? And it's both. Types of families. So I'm sure you all know there are so many different types of families. There's the nuclear family, which is the traditional idea of family that we all think of here in the US. There's extended families, so your cousins, your grandparents, aunts, uncles, single parent families, foster parent, alternative. Blended is, maybe a parent had got remarried and that new spouse has their own children, so it's blended. It's a blended family. It is a little bit more, it has increased somewhat, but polygamous families, polyamory, that has become more of a thing. And I've seen it personally, and you might encounter this. on labor and delivery or mother baby, that there are maybe 3 people there. Homosexual, and then cohabitation. All right, family APGAR. And APGAR is a term that we'll use also when we're assessing the newborn. But basically, it's an assessment of the family function. So what's the adaptation, the partnership, growth, affection, resolve. So just by observing the family and kind of assessing the health of that family and how they interact, and if there is a nurturing, if they're fostering growth and development and love. So it kind of helps that nurse understand how that's impacting the child. So when we're talking about theories of developments, we're going to get into a couple of them here. And this will be crucial when we're talking about developmental milestones, any development with children. You're going to want to use these developmental theories. And you will also have a paper at the end of the term that'll be due and part of your clinical course. But basically, you're going to observe a child and compare what you observed to one of these developmental theories, and if it correlates, if they're on track, if they're behind, so you're just going to observe, compare, and evaluate based on whatever developmental theory you choose. So we're going to start with Erikson's stage of development. So with his, these are some of the components, or basically what his does. So tasks must be mastered at each stage to achieve optimum maturity. Each builds on the successful completion of the previous stage, and parents must interact with their child to assist in mastering the various stages. So I never know if I'm saying this right, so I apologize. Paget's theory of cognitive development, so intellectual ability. So this focuses a lot on intellect. So intellectual maturity is attained through, according to this theory, 4 orderly and distinct stages: sensory motor, pre-operational, concrete operations, and formal operations. Ages for each stage are approximate, so their ranges consist of interactions and coping with the environment. Kohlberg's theory, so his theory focuses on morality, so moral development. Sequential, 3 levels. There's pre-conventional, conventional, and post-conventional. Each level contains 2 stages. And again, the emphasis is on conscience of the individual within society. And we will get into these theories in more detail later or in class. But that was just a brief overview of the 3 main theories. Now, of course, there are several others. Of course, there's Freud, and a couple others that you can include if you wanted to. So parent teaching. Experiences in dealing with challenges and disappointments prepare the child to function independently into adulthood. So teaching the parents to encourage their child to deal with successes and failures appropriately. So socially acceptable outlets, intervene only if it becomes overwhelming, if they're not using socially acceptable outlets or behaviors when they have a success or especially a failure. So parents' task is to provide the child with skills and tools appropriate for each age level. Nutritional heritage. Some families do not consider food a priority. And of course, you need to keep in mind what their nationality is. Their culture plays an important part on that. A lack of adequate nutrition obviously can lead to decreased intellectual ability, especially at an early age, if they're not getting those nutrients that help their brain develop appropriately. Obese children may be subject to decreased motor skills and peer rejection, which can obviously impact the rest of their life and their behaviors from there on out. So the nurse's job is to identify children at risk nutritionally and assist the family in modifying eating habits. If they're maybe they don't have the finances, they're not able to afford the food that they should be feeding their children, providing them resources on how they can get assistance with that is very important because there is assistance out there. So just helping those parents know how to do that. Food, obviously we know what food does, helps regulate the body processes, provides heat and energy. So nutrition and health. The digestive system of the newborn is immature and functions minimally for the first 3 months. Saliva is also minimal. So hydrochloric acid and renin in the stomach and trypsin found in the intestines aid in the digestion of milk. So the physiology of the digestive tract is the basis for introduction of various foods in the first year of life. So that first year of the child's life, the parents are going to be educated on when and what foods to introduce at what points. And it's based on if they introduced this food, if it went well, they can, ease their way into introducing another food. So that plays a part. So to help prevent some illnesses, it's not recommended to significantly restrict fat or cholesterol because it's needed for calories and the development of the central nervous system. So ensuring that you're educating parents not to restrict their child's diet. Sometimes if a child is in maybe an activity like dance or a specific sport, they might feel pressure from their parents to restrict, or the parents might go ahead and restrict their intake, and that's not healthy. And so educating them on what's appropriate for that age is important. Nutritional needs may be changed because of the severity of an illness. Childhood obesity, obviously, we know that it's a problem and it's increased in the past 3 decades. So these are just some stats on the prevalence of it. It's also related to obesity in adulthood. If an obese child continues, if they're obese in childhood, they're typically going to continue to be obese into adulthood. Not always, of course, there's always exceptions to everything, but typically that's what you'll see. Oops. So it can cause health problems in adulthood. Obviously, we know this, blood pressure, cholesterol, and of course, insulin regulation, most often related to diet and inactivity. And then body mass index or BMI is important to keep in mind too. So feeding the ill child. So let's see what I want you to know here. So that's basically just depending on the illness and how severe the illness is, just making sure that the nurse obviously makes sure that the child is getting the appropriate nutrition. And of course, depending on what they can eat and how the method of feeding, just making sure that they're getting what they need at that stage. So a good rule of thumb, a tablespoon of food for each year of age is a good guide to follow when feeding a child. So sweet drinks and snacks do not give just before meals. And infants who are placed on NPO status should be provided with a pacifier to meet their sucking needs. Food-drug interaction. So drug-drug interactions. So the nurse, you need to know as the nurse the side effects of each drug prescribed and administered. So does one drug have an impact on another one? And so just knowing that is important. Drug and environment. So this involves the interaction of the effects of the drug on response to the patient environment. So antibiotics, for instance, some antibiotics can cause pronounced photosensitivity. So educating parents that if they're on a certain antibiotic, they need to stay out of the sun and put on a lot of sunscreen, just as an example. And then drug food. So are there any foods that are contraindicated when the child's receiving certain drugs? So if they're taking Coumadin or a an anticoagulant type of medication, foods containing high levels of vitamin K can have a detrimental impact on bleeding. All right, so teeth. Important not to neglect baby teeth. So these baby teeth serve not only in the digestive process, but also in the development of the jaw structure. If the teeth are lost too early, the permanent teeth can come in poorly aligned. So delayed and early eruption of these baby teeth can be indicative of certain endocrine disorders or pathologic conditions. So just keeping an eye on that. If they have teeth, they're starting to get teeth early, or they don't have teeth at a certain age where they should have a lot of teeth, that can clue you in on maybe there's an underlying condition that we need to check for. So oral care continued. So sticky foods have more potential to cause dental caries or than do sugar drinks. So sticky foods compared to sugar drinks can cause more issues there. Snack foods to avoid: sugared gum, dried foods, sugared soft drinks, cake and candy. I think we all know that. So recommended snack foods: cheese, milk, maybe sugarless gum, raw vegetables, things with protein. So brushing after each meal and snack. So educating parents to ensure that they're brushing, depending on their age, that the parent is brushing their teeth after every meal or snack, or that they're teaching their child to do so, which can be difficult as they get into their preteen and teen years, especially for boys. I know I have trouble getting my son to do that, and he is a teenager now. So just making sure that they're brushing their teeth. And then eating a healthy, balanced diet. So dental caries or cavities occurs when infants fall asleep while breastfeeding. So, or they're put to bed with a bottle of milk or sweetened juice. Sugar pools in the oral cavity, and it's most often seen in children 18 months to 3 years. Education on tooth hygiene. It starts with the first tooth eruption. So even though they have 1 or 2 teeth, brush those teeth. Brush before bedtime, of course. Fever is not associated with teething. That is a common myth. Therefore, cause should be assessed. So just because they're teething doesn't mean that they should have a fever. If they have a fever and they're teething, please educate the parents to look for another cause and not to ignore it. Replace toothbrush every 3 months, especially after a viral illness, or every 3 months. But if there is a viral illness, please replace it right away. Educate them on that. Avoid rinsing bristles in hot water. And do not use closed containers for toothbrush storage. That has to do with bacteria. And avoid sharing toothbrushes. All right, so moving on to play. So play is the work of children. It allows for creative expression, and hospital playrooms are used by children as long as they don't have a communicable disease. And most hospitals, even the smaller pediatric units like at Ball Memorial, so they will have a lot of different types of toys, and they do have video games that they can bring into the room depending on the child's preference and age. So that is important to make sure, even when they're hospitalized, that that you're, as a nurse, incorporating play into the care. Nursing interventions should focus on encouraging optimal play activities, of course, age appropriate, helping parents select age and illness appropriate toys, and children should not be given stuffed animals to play with. All right, so that's just a quick, brief overview of growth and development. So we will have more in-depth growth and development lectures and content in class, but this was just a brief overview to kind of prepare you for what to expect this first week content. So that's it.